Again, good afternoon, everyone. Today's webinar is a three-part series with part one focusing on reassuring patients after COVID-19. We've been waiting a couple of minutes here. We're getting ready to get started. As we go through this webinar today, please feel free to go ahead and submit questions at any time during the webinar. Additionally, in the handout section, please see our accelerated revenue recovery handout. Again, my name is Ben Bible, and I've been with Well now for just over a year as a client success executive. Today, I'm joined by Meg Aranow. Meg is a platform evangelist at Well Health. Before joining Well, she served as a chief executive officer for Adaris Health and senior research director with Advisory Board's Information Technology Strategy Council. Previously, she was a vice president, and chief information officer for Boston Medical Center for more than a decade. Meg, I'll go ahead and turn over to you and let you get us kicked off here.
Great, Ben. Thank you so much. I think we can just go ahead to the next slide. Let me acknowledge that the topic that we've got today is a big topic. We're going to fit it in a small envelope out of respect for how busy you all are. And also just one other note, I want to say that I think all of us have seen in the news yesterday and today that those of you on the call who are working in the southern part of the U.S., many of you are experiencing a new or renewed surge in the number of COVID-19 patients that you're seeing. So let me acknowledge your hard work. Let me thank you on behalf of all of us. And if you need to drop off early today, we'll certainly follow up with you at another time. But even as that's happening in the southern part of the country, we know that many folks on the coasts and in the northern states are actually on the downside of the curve. They're starting to think about reopening. Some have already made some significant strides in reopening. And really, that's what the focus of our conversation today is about. We've developed a plan or a strategy that we think is effective. We've been talking with our customers. We've been listening in on webinars that many of you have held, and we've been doing our own reading. And what we can see is that we think an effective model, and one that would be able to handle the surges should they peak and valley, as many experts are now predicting, is a model of reassure, reschedule, and recover. The reassurance is the piece that we're going to focus on for today, and there'll be subsequent webinars to take on the other pieces. Our model is really designed to address the statistics that you're looking at on the screen in front of you. We know that 36% of those folks that would be coming to see you are nervous, and they think that there's a big risk of going to the hospitals or to the practices today. Interestingly, and sort of horrifyingly, compare that to the fact that 27% are afraid of going to their hairdresser. So never did we think we'd be in a situation where our patients were more afraid of us than they were of their hairdresser. But that's where we find ourselves today, and of course for good reason. We all really know the reasons. 55% cancel, were canceled at the height of the pandemic, and that doesn't even account for the new patients you might have been recruiting during March and April, and it's certainly into the beginning of May. So you've not only lost those people that were previously scheduled, you've also lost that opportunity coming from referrals and people newly moving into your community. We think that last month in May, we were beginning to see a bounce back. We know that among the Well customers that we serve, they'd begun to significantly recover their volume, some as much as 76%, a little north actually of 75% coming back in. But there's a long way to go still. We've got all that gap to make up in terms of trying to fit that volume back into our schedule. And so while that work has begun, we expect it will continue for many months. I think, Ben, why don't we go on to the next slide? So while this is not the first time we've been here, for many of us, we've experienced times when we needed to close the doors to our facilities for other reasons, whether those were strikes that were being taken, weather-related events such as Katrina. There have been times when we have had to turn patients away. But this time is very different, and it's really very different because of the fear factor. It's not really external events as much as really internal events, that people are afraid about returning to our facilities. Not that we artificially have closed the doors for some reason, but and kept them away. But now that we're reopening, they're unsure, and they're unsure for their own safety. And Ben, I think you're going to tell us a little bit about what some of our own customers have been doing to address this issue.
Yeah, absolutely, Meg. And you really hit the nail on the head there. Well has worked with some of the leading health systems across the nation to tackle these rapid communication efforts, as well as focusing on recovering during and following these events. Due to these efforts, Well has developed kind of a perspective on best practices to really help the hospitals re-engage through this process. And although the recent focus has been on COVID-19, to your point, Well has played an instrumental part really in re-engaging those patients for a number of events. Kind of through Well, patients have been notified, and again, you touched on this, even before, during, and then after natural disasters. You mentioned Hurricane Katrina, Hurricane Harvey, flooding in different regions, hurricanes, of course, in different regions along the coast, as well as those Tornado Alley in the middle part of the country here. And then we've also done some simple informational updates, such as facility relocation, something as simple as letting a patient know where they need to go to get to their appointment, and even directions on how to locate an office within a hospital once they get there if it's a large building. Just recently, we actually had a client that was able to rapidly notify patients of a water pipe bursting in one of their buildings. They have an extremely large building, and because of that, it required the building to be closed. They were able to actually very quickly notify all of those patients for the actual building closure itself. They were able to cancel that day's booked appointments and in the affected building itself, and then they were able to go ahead and reschedule for a later date and time with those patients, all through the power of Well and that patient communication. So really exciting time to be part of patient communication. And Meg, I'll hand back over to you on why this really matters.
Yeah, so great. Let's talk a little bit about that. Here's some statistics that I won't read them to you. You can see them for yourselves, but we wanted to share them with you. And they might be helpful as you begin to go out to your teams and start to craft a response to what these statistics are telling us, right? And they're talking about reassurance. I was really awakened to this issue by listening to a webinar that the advisory board gave, where they were citing statistics from a Revive study. And one of the things that they said that is not on this slide that I found really telling, and at least it really changed my orientation about how to think about this problem or this challenge that we have, is they said that hospitals would be able to return the capacity to see patients much faster than they would be able to attract those patients back into their facilities. By their estimation, hospitals and practices could return at least 20%, and frankly, we're seeing much more than that with our own customers, but at least 20% of capacity every month. But that their ability to attract and reassure patients to re-enter the facilities and to take those slots would lag that by far. So to me, that was very telling to me, and it was really the first thing that made me think about reassurance as a strategic objective. I think that, it's only in the future, frankly, that we're going to know not just what this has done about volumes and revenue, which we'll certainly talk about here, but what has this done in terms of the clinical effect of the delays, right? People are talking about it, but of course we haven't had the longitudinal studies we need yet to see what kind of impact the delays in routine care, particularly for those people under disease management situations. We haven't seen what that effect will be. And I think once we do study that, we here at Well will probably come back and revisit this model, because I think we're going to learn quite a bit more about how to inform the future decision-making about closures and about how we segment patient populations to ensure safety and ensure that those that are working under disease management get the care that they need throughout a prolonged period of I'll call it lockdown, of deferment. So I think there's still more to learn, but what we know right now is that hospitals have a huge gap in terms of where they expect it to be, in terms of patient volumes and revenues, and where we actually find ourselves. So We understand from all that we have read and all we've listened to from our customers that reassuring patients about the safety of returning to the institutions is really top of mind for everybody right now. Whether they're using a well communication platform or another kind of communication platform or hard copy press or emails or whatever it is that you're using, those messages of reassurance are the thing that everybody really should be thinking about now. Even those who are starting maybe to see a second spike in the surge, it's really not too early to start thinking about what's going to be on the other side of that curve. Ben, I'm going to hand it back to you.
Absolutely, Meg. And what you're touching on there, that communication and really the best practices around that, really through seamless patient communication, clients with Well have been developing best practices really before and during COVID-19 on a large scale kind of proactive approach. These unique approaches have allowed them to communicate with patients that had scheduled appointments that were impacted, as well as those patients that did not. A great example of this with as COVID-19 kind of rapidly removed across the country, Houston Methodist was able to send in one day more than 260,000 messages. Those messages went out to alert patients of the critical actions and changes impacting the Houston Methodist health system. Other health systems took advantage of keyword automations where patients received an immediate response to their questions as soon as they were able to communicate or communicated with the health system itself. And based off those keyword responses, they were able to open that door to the broader discussion with the actual hospital's users and get additional questions and needs answered along the way. Hospitals really began sending two-way messages to reassure patients of the rapidly changing nature of the patient's path to care, and then really as well as a means to provide immediate updates and notifications due to that changing nature of COVID-19 and the impacts that it had. The closures, the appointment cancellations, and then moving to that telehealth approach as well. So lots of really interesting ways that we were able to be a part of that communication and open those channels to patients and allowing them to communicate with the hospitals and their staff as quickly as possible. All right.
Yeah, thanks, Ben. So, I would say we've all been reading constantly about the sea change in telehealth that came about as a response to this pandemic and how the utilization of telehealth has drastically increased based on the change in perceptions of both clinicians and patients. I think that the silent follower of that has been the use of these automated communication tools to reach patients. For things like rescheduling, for things like reassurance. I mean, imagine trying to reach all of these patients in this sort of old school way of, one phone call per patient and getting voicemail, not getting to the right person, having to spend time on the phone, et cetera. So I think, although it's gotten less press, the use of this automation has had a huge impact on our ability to manage how patients access our facilities, et cetera. So I think we'll continue to hear more about that both today and also into the future. But we need to talk a little bit about money. It's not something that healthcare always loves to talk about, but it is an important part of what's going on here, right? So healthcare has always had historically thin margins, at least most of healthcare. There are certainly some well-endowed systems out there, but most work on very thin operating margins. Fully 1,200 hospitals have been in the red 2 of the last 5 years, and that's pre-pandemic. So then the pandemic hits, and we all knew what happened, right? It devastated many systems. Some systems will close permanently. Many of you are probably in a situation where while your facilities are still open, you've had to downsize by furloughing staff that weren't relevant to the immediate care that was necessary, those folks that were working in primary care or other places where you could effectively defer patient appointments. So there'll be some downsizing. And I think many of you now are thinking about, will I be bringing everybody back? Do I have the capacity? How long will it take to rebuild? And even once I've rebuilt the slot capacity, I still have to make up for these couple of months where I was working so far below capacity. So what's that going to look like as I bring staff back, and what can I do to work around that staff deficiency that we may have? There's also been studies lately that say this is going to spur a new era of consolidation. So your hospital's open, but are all the hospitals in your area open? Will they all be able to come back? So I don't want to seem unseemly about this, but this is also a time to look around at your competitive landscape and say, not only am I going to attract my patients back, but are there other patients in the community that I now have an opportunity to attract to my facility? And is that one way of recovering some of the financial hit that I've taken? So no matter how you look at it, whether you look at it as providing care or look at it as a strictly bottom line event, the imperative here is to bring people back into your facility as quickly and as safely as possible, whether it's your own patients, whether it's community members, or whether it's wholly new patients who maybe have had a change of insurance and coverage during this time while they maybe became unemployed or maybe had other life events that were causing changes. Okay, Ben, next slide. So let's talk about patient concerns. We put up some questions. You probably have a list twice as long that's from your own family members and your own neighbors in terms of what they're asking you about the safety of returning to your facility. We are all inundated with information that's coming through news channels, coming through our social media. Much of it is legit and professional and is delivered in an even-handed way. Unfortunately, some of it is also scary and unfounded and a bit on the conspiracy theory side of things. But we're inundated 24 hours a day. We all have been. Many of us have been glued to those sources of media, just trying to understand. And the concerns are legitimate. There's no question. But this really is the time to think about winning your market. Not that any of us want to necessarily take advantage of people's fears or of your neighboring facilities' distress, but this is the time that you want to reassure your patients, tell them what's happening at your facility, not what's happening in the larger community, the larger state, or the larger country, but what's specifically relevant to them, to their caregivers, and to the way you're going to manage this going forward. So this is all about communication now, and we're going to spend some time in the next few slides talking about that. But if ever patient engagement was important to the health and well-being of your institutions and of your community that you serve, this really is that time. Okay, Ben, let's keep going.
Absolutely, Meg, and you're spot on there. Across the nation, folks are concerned about the safety of not only themselves, but their loved ones. If they're taking children into the clinic for the first time after, or maybe a one-year checkup or whatever the case may be. And because of those patient concerns, several of our clients, such as Unity Point, really went through the process of figuring out the best way to communicate and take care of those patients. Unity Point was able to fast track a virtual waiting room experience where through a series of guided reminders leading up to the appointment itself, and then two-way messaging communication to answer very simple questions, they were able to guide those patients through that arrival process. Very interestingly enough, the patients would show up after the reminders, get there about an hour before their appointment, alert the staff that they were then in the parking lot. At that time, the staff would then come out to the parking lot itself, go through a screening process, checking temperature, asking a few simple questions, and then walking through that check-in process, all right there at the safety of their car without any cross-contamination. And then really a big part of that was alleviating those patient concerns. And we had seen just through those processes, some of the patients were able to text back in just thinking how fast and simple that process was. And we were able to actually see some patients saying, this is great, I wish we could do this all the time. So really interesting, even though in midst of a pandemic, how we're able to make changes really on the fly and help a hospital system out to get those patients in the door and make sure that we do it safely.
Yeah, and Ben, I'll just jump in here to say too that we've also begun to talk to some people who are extending this idea of the virtual waiting room to have that be a pre-screening area as well, right? And then even beyond that, thinking about pre-reg or e-check-in if they haven't yet implemented that, which not only does it serve us well in this process because we're serving patients remotely as opposed to having to have face-to-face conversations, but it also happens to be a huge patient satisfier. So, definitely a win-win with the pre-registration work.
Absolutely, Meg. And that really ties kind of directly into not only the pre-registration, but the demonstration of safety going in, and really the new approach in light of this COVID-19 pandemic that's kind of ransacked the nation. This here, due to the rising concerns really over the exposure of COVID-19, we've seen some clients go through some options and really pushing and showing how they're conducting safety in their areas. University of Alabama went and did this really well and kind of went the extra mile to reassure their patients on the safety protocols and measures that they're in place, that have always been in place, but really now more so than ever, and making sure that clean and safety is top of mind. So they were able to send out a video really walking through what is happening behind the scenes and how they're keeping patients in mind and keeping them safe with their staff coming into rooms. They went as far as actually going in and making some changes to their waiting rooms. And so really just demonstrating that to their population to make sure that patients knew if you did have to go see the provider or see a doctor, that you are walking into a safe environment.
Yeah, I love that UAB did this. I think it's really smart. It's really taking a page from the restaurant and hospitality industries. What they really led the way of saying a lot of those things that maybe we've been trying to keep behind the scenes because of our sort of politeness and because of what we thought patient expectations were. So a lot of the sterilization, the cleaning, those kinds of things that we did as discreetly and subtly as possible, the restaurant and hospitality industries are saying, no, move that to the front. Let everybody see that. Let them see how many times you're wiping down the chairs in the waiting room or cleaning the screens on the kiosk. It's part of that reassurance policy. They want to see that, and it makes them feel better about it. So I think it's great that they did this. This is really a chance for health systems to take back the narrative, right? We talked about the influence of social media. This is your chance to talk about and then actually demonstrate where your safety procedures are going and how you're going to keep up with them. Make sure that you're the trusted source of information for all of your patients. Start to move that away from the social media feed and back to where it always has been before, which is your clinical teams making sure that their patients are safe.
Absolutely, Meg, you're spot on there. And really that kind of takes us into really how we as a community, as a health community, can really provide guidance to those patients. Not only have clients alerted patients on the new protocols through our platform, but they were able to update appointment reminders and broadcasts. Simple or very quick changes allowed hospitals to alert patients to new entrances that they've manipulated in the facility to make sure that entrance is safe, sending out social distancing guidelines and changes that have been put in place. We've all seen throughout this whole time that those guidelines have rapidly changed, sometimes several times within a day. And so being able to get that information out very quickly is extremely critical within those facilities. Some of the content we've seen was customized to alert patients on a lot of the safety measures. So patients were coming in with their own mask, and then sometimes they were not coming in with a mask at all. And so patients would ask the question, hey, if I don't have a mask, where do I get one of those? And so it was very quick for the staff to say, hey, no worries at all. We'll provide a brand new one to you as you're entering the facility to make sure that you're all taken care of. Other simple communications, once you've arrived, we'll meet you at your vehicle, or we'll meet you at the door and escort you to a new room or a clean room. And again, just several other communication models to really reassure and provide that guidance to the patients themselves. Another piece that we've seen as far as personalizing that reassurance is really the use of campaigns have allowed for obviously mass communication through well, but also customized communication. Something as simple as addressing a patient by their name to show a level of reassurance and knowing not only who they are as a patient, but what their concerns are can really go a long way as far as that reassurance and making them feel safe coming back into the practice themselves or the hospital themselves. This level of customization can allow focused communication to groups of patients with certain conditions and treatment regimens, such as oncology. We have several oncology practices that have patients that are coming in on a daily, weekly, or monthly basis. And so really being able to communicate that the information they need to come into a safe environment and receive the care that they need is just absolutely critical.
Yeah, you know, and I'd say it's a good reminder that this isn't just a one-time recall, right? This is your patients right now are so focused and hungry for communication from you that this is a great time to re-engage them in your disease management programs and to keep them coming, right? So not just for this first time return visit, but keep them coming in, engage in patient education. If you've got software and vendors that provide that is another great way, or if you've got specific disease management programs, again, a really good way to make sure that while their eyes are all trained on you, it's a great time to push out whatever messages you think are most important.
Absolutely, Meg. Perfect. And folks, I think we've come down to our Q&A session, and so I did see a couple of questions come in, and I wanted to go ahead and address those. Just starting kind of with the first one on the top of my list, the question is, what is your timing of appointment reminders? So this is an absolute great question and really keys in on the ability to customize, or the customizable capabilities within Well itself. Specifically around appointment reminders, you as a client would have the ability to customize each individual reminder to what fits your workflow the best. So if that is a 1 day, 3 day, 7 day reminder that's going out to the patient to alert them of an upcoming appointment, or even say 14 weeks out, or say, you know, the mid part of the year, there's an annual visit, we can absolutely customize those appointment reminders to fit whatever your team's needs are and your custom workflow per practice or per hospital. So very, very simple process that we would walk through and make sure that we bring that information and make that available to you, as well as teaching your teams on how to make those changes very quickly and on the fly. Next question I see is, how do you measure success of using Well? Again, another really great question here. We have been able to measure success through specific metrics captured during really the initiation of the project. Well has developed an ROI playbook to really help capture those metrics, such as patient no-shows, the amount of time your users are actually spending on the phone with those patients. We can see recall data and even referral data. So really the sky is the limit when it comes to what we can capture, working alongside you and capturing that information really at the initiation of the project itself, and then tracking that really through a 30, 90, 120, 180 day period to show that ROI itself and how we capture that information. And then of course we provide feedback back to you along the way as we're capturing it. So really, really great information at the onset of the project and then throughout the project itself. And then the last question I'm looking at here is another really great question. What is the protocol for home visits? So of course, because each client and each visit, each appointment themselves are all unique, whether it be an in-office visit or an actual home visit, our goal would be to first understand what your current protocols that you would have in place and what you're doing today when it comes to workflow, how you're communicating with those patients. And then really, how can we add in Well's technology to ensure that we mirror that process and then of course improve on that via the communication perspectives or ways that you may have to get that information out to patients, as well as update and change that workflow to mirror that as well. So those are the 3 questions I see. Meg, I'll pause there and see if any more come in, and if you have any color to add to those there.
Nope, Ben, I think you covered it. I think did a great job. If anyone hasn't had time to get their questions in, feel free to reach out following our session today. We'll be glad to talk with you.
Absolutely, Meg. And so Meg just touched on it there, but again, we'll be getting this webinar out. It was recorded today. If you do have any additional questions, please feel free to send those in so we can get those answers back out to you. Reach out to your sales representative or your CSE if you're a current client. For current customers, please reach out to us via the support@wellapp.com email. You can put post-COVID webinar in the subject line, and we'll be sure to answer any of those questions. And then if you have any questions about the product itself, of course, please email us at well@wellapp.com. And like I said, we'll make sure we reach back out to you and answer any of those questions. And with that, folks, thank you for attending. I hope you found this part 1 of this series to be useful. We will have a recorded version of this webinar available, and we'll be responding to any of those additional questions. But thank you so much for your time, and hopefully this was extremely beneficial, and hopefully you're looking forward to part 2 and 3 of this 3-part series.